All right. Hello, everyone. Welcome. I'm looking forward to such a great conversation today with my mentor, Mary Lee LaBay. My name is Jodie Solberg, and I'm a certified master hypnotherapist and transpersonal wellness coach. And those are titles that I actually earned in Mary Lee's programs. I have been a hypnotherapist actually since 2001, so many moons before I actually met Mary Lee. Because I come from the mental and behavioral health field. I've been doing that for 25 years now. And I work with a lot of trauma, anxiety, burnout, adults as well as children and teens, and a lot of pre and perinatal psychology as well. And when I met Mary Lee, oh gosh, about 6 years ago, 5, 6 years ago, she had actually mentored and taught some of my friends who had gone through her classes for hypnotherapy at Bastyr and Bellevue College. And I was wanting to work more virtually. I was wanting to create Psyched Up Success, which is my business now, because I was keeping coaching and therapy very separate at the time. And I really wanted to start my own hypnotherapy practice, working more from home so I could recover from my own burnout and take care of myself first and really help people on a deeper level. I knew that I was working with people who had a lot of past challenges, traumas and anxieties, like I mentioned, or even a lot of chronic health conditions, and they weren't getting all the answers that they were looking for. They had gotten so far, and I'd have experienced this in my own health too. I've gotten so far with the medical community and everything that could be helped on that physical level, but there was something deeper going on. And so I reached out to Mary Lee and took her class in 2019. And she hasn't been able to get rid of me since. I've been hanging out ever since then. And I'm really excited to have a conversation today about this really deep transformative inner healing and how we can use hypnotherapy techniques for pain and trauma relief. Because in one of her classes earlier this month, we actually had this amazing transformation with one of my fellow students. I'm alumni now, but I get to sit in. Mary Lee allows us to do that and continue to learn. And one of the participants had a wonderful healing happen literally right there in front of us when Mary Lee was doing a demonstration. And so that's what we're going to talk about today. So Mary Lee, I would love for you to introduce yourself, tell everyone about you, because you have been doing this a long time as well. And then we'll get into the whole story.
Well, I'm Mary Lee LaBay, as you said, and I teach hypnotherapy. I've written 6 books on hypnotherapy and past life regression. I forgot to bring them here, so I don't have them to show. But I've written 6 books, and I've been teaching pretty much 25 years, teaching professional training in hypnotherapy and past life regression. And my own interest and involvement in it, goes all the way back to about 1985. But then started teaching in 99. I believe that it was that year that I became a certified instructor of hypnotherapy. So anyway, that's my background. But as I entered into the field, I had been trained, just a little bit about me and my journey. I had been trained to use scripts in hypnotherapy. So, and that's kind of a traditional way of learning hypnotherapy. You interview the person, you find out what they want and all about them. And then you go to tomes and tomes of books and you look through scripts, or you spend some hours writing out a metaphor and a story that then you can read to them under hypnosis. And for me, it was a very nerve-wracking way to do it, because there was no way to really tell if they were deep enough, or if the story resonated with them, or if it was working. So you'd bring them out and send them on their way and kind of cross your fingers. And so as I was working, I, incorporated a lot of NLP, a lot of psychology, and kind of tweaked a lot of the techniques. And I even developed some new techniques that we can use in the hypnotherapy, within the hypnotherapy, what I call the hypnotherapy envelope, of putting them into trance and bringing them out. And then in here, we do all this work. And so no scripts, it's very client-centered, very organic, one-on-one, meeting the person where they are and listening to them and responding with specific questions to address their issues. So I developed a lot of that. There are other people out there doing similar work, but I've devised kind of a unique approach to hypnotherapy.
Yeah, absolutely. And that's really what drew me to you and your work, was how client-centered it was and how customizable. It isn't just, like you said, cookie cutter, one size fits all. Let's read a script for fear of falling, or let's read this script because somebody can't sleep or wants to quit smoking or whatever it is. That it is very much open-ended, and there's a series of techniques that you teach that we can pull from, right, for any scenario. And it is so effective and is really meeting people where they are, because inevitably what's going to happen is you're going to get into a session with someone and you think you're working on one thing, their subconscious presents with something else. And if that isn't in your script, you don't know what to do. And so, yeah, I was very much drawn to that part of what you do. And you do have some very unique techniques as well. You mentioned metaphors, for example, and that usually, or traditionally, right, in the past, hypnotherapists would show up with metaphors. And you see that all the time still in things like guided meditations, where it's like, imagine this particular thing in this particular place. And we're telling them what to see and what to do, versus having them tell us the story. Like in your reverse metaphor, it's important to allow the client to go to their own safe and peaceful space versus telling them what that looks like, right? One person might go to a beach, one person might be in a meadow, one person might be, in their childhood bedroom, who knows? But we're not, giving them that direction. We're allowing them to find whatever is best for them. So that was definitely something that I valued in your trainings. And so I would love for you to talk about this case that I mentioned earlier about one of the students in your most recent class presenting, because you always invite people, if they want to do a demo with you, they get to do that in your classes. And she had had a surgery, right, on her hand. And tell us a little bit about that and what types of techniques you used in order to bring about this amazing transformation for her.
It was a very interesting case. I was teaching how we can use hypnotherapy to help people before they go into surgery to kind of clear the pathway, get permission from the body, prepare the psyche, the emotions, and then and then we can do something fairly similar post surgery. But it's, after the surgery, we can't quite program the mind to knit the body back together properly. And, we don't have quite the support that we would have pre-surgery. But during the class, I said, I always like to demonstrate the techniques that I'm teaching. And I just asked, does anybody have anything? And it's always a gamble, because every time I'm teaching a different technique, and I have to find somebody in the group that has something that relates, or I'm going to have to, turn the situation in a way that would address, or that would allow me to utilize the technique that I'm demonstrating. However, we just happened to have somebody in class who raised her hand and said that, she was having trouble. She had a big lump right under her middle finger here, and she called it a trigger finger, and it was frozen in some kind of awkward position where she couldn't move it. And obviously this lump was a big problem too. And so what had happened is she had taken a real sudden fall. I mean, I suppose a lot of falls are sudden, but she was at work and I think she was carrying something anyway. She tripped and fell and bruised, I guess it was the right side of her body. So she bruised this whole side of her body. And evidently her hands also went down to brace her. And the body healed, but there remained this problem with her hand. And so she had gone in and actually she acquired this lump in this trigger finger, although maybe the lump wasn't there before the surgery. I don't know. But they performed surgery on her and her hand worked. And then she said about 2 to 3 weeks later, it went back into the trigger position and froze up again. And then this lump developed in her hand, right below the finger. And so it had been a couple weeks or a month or something that was happening. She went back to the doctor, and the doctor said, well, there isn't much we can do except, oh, no, I know. She went back and she got cortisone. That was what happened. I have to remember the case.
I remember that too.
Yeah, right. So she went back as the trigger finger. They gave her cortisone. This was after she had done surgery on it. She did surgery. Some time went by. It came back. They gave her cortisone. Some time went by and it came back. And so she then went to the doctor and said, here we are again. What can we do? And he said, well, there's not much except if you want to do another surgery. Mm-hmm. And that's when she was in class and volunteered. And she said, well, I really don't want to do another surgery. And there's no guarantee that this is going to work. So she volunteered and I put her into trance. And so there were several techniques that I used, in combination. And as we go into trance, I'm never quite sure exactly where we're going to go or how I'm going to address it. Sometimes it's a little clear, but you go in and as they're responding to different prompts, you're starting to get a clue. So I decided that I wanted to desensitize her. And that was part of, the demonstration or the reason to have a demonstration. So in this case, we there's some specific steps you take, but you take them through the event to the time when she knows that she's safe and she lived through it. Because a lot of trauma is, the reason we carry trauma is in that moment, there's this sudden break in our energetic field, this sudden shock for us. And there's a part of us that thinks, am I going to die? Am I going to be in pain forever? And then as we heal and move on, we never really address that shock that was there. And so that echo is playing out in some way. In her case, the echo was playing out in her hand. So I knew that the trauma was embedded in there somewhere. So we went through the scene until she knew she was fine. And we did that a few times. And correct me if I'm missing anything. I should have read back over the notes, but from my memory, I started helping her to change what she was experiencing. And so I said, what could you do to make this fall now that, as you're going into it, you already know you're going to fall, right? So as we're going across this event horizon, she gets to the other end, and then when she comes back to the beginning, now there's a part of her that knows what's going to happen, which helps the client to reduce the impact even post trauma, right? And so I said, you already know you're going to fall. What could you do to protect yourself from getting harmed? And so she said, I'm going to wrap myself in a bubble, right? So like bubble wrap or something. And so now we go through it. And when she falls, she just kind of bounces, and it's really not that bad. So we do that a couple of times to really reprogram her memory of that. And again, this is client centered. So I'm not telling her what she needs to protect herself. This is how she's seeing it. So then we get through that. And then there was a point where I was talking to her hand. So we have a technique where we can talk to the body. And so we sort of personify, in this case, the marble. She called it a marble that was this lump. My name is right there. This lump that she was experiencing, she called it a marble. So we started talking to the marble, and the marble said that it was trying to protect her. So it was creating a protective bubble, basically, here on her hand, because it expected, again, to take a blow, right? So that trauma had been embedded in her subconscious mind, and her subconscious had created this condition in order to protect her. So I know that at that point I need to negotiate with that bubble, and I can't remember the exact wording, but conversations in that regard would be something like, well, that it wasn't that bad, or, is there a different way that you could protect that didn't involve freezing her finger and creating this marble? And so, there's some negotiation that happens there. And the marble, I guess, decided that it understood that it was unlikely that this would happen again, and that it really didn't need to protect her all the time. Do you remember that part? I don't know if you have that part in front of you. You can correct me, but it did decide to reduce.
Yeah, it decided to reduce because exactly. Oftentimes that's the case, right? Is that there's a part of us that's trying to protect us and guard. And so it decided that no longer needed to do that anymore after processing through the experience.
Right. So then at that point I asked it if it would be willing to, do something different to protect her. In other words, instead of creating this lump, what about if there was an impending danger, why not just warn her to be a little more careful, to try to have more of a behavioral change rather than, this unsavory condition in her hand. And so it eventually agreed that, yeah, I don't need to be doing this if I can help protect her in a different way. So then I asked, could you do it now? And, going into this, you never know. Quite honestly, when we went into this, because it was post-surgery, I kind of thought, well, we'll make some improvements, and then she'll probably have to have a follow-up session, just kind of guessing where this was going to go. Well, the marble said, yes, it will reduce now. And so I said, well, go ahead and do it. Thinking, even to myself, thinking, 50-50, it either is or isn't going to happen. And she looked down and she goes, it's getting smaller and I can move my finger. And within minutes, she said, it's gone. And she was doing this,
Mm-hmm.
And and it was completely gone. Did I lose you?
I can still hear you.
What happened? I had some things flash.
Hmm. I
You
don't
can,
know.
but you
I
can't see me?
I can see you and I can hear you.
Okay, I've lost it here. So, okay, I'll
Just keep
proceed.
talking. You're fine. I'll let you know if it changes.
Yeah, I'm blind now. I can't see you. So weird. Okay, well, anyway, so it was completely gone. And so, then as hypnotherapists, we hope that this will stick.
Mhm.
But my philosophy is when we do this work, whether it's drinking, smoking, weight loss, stress, anxiety, trauma, um, yes, hopefully we're getting success right there in the moment. But what I tell my clients is if somewhere down the line the symptoms return, don't look at that as a failure. Look at it as more information. And so now we have, if something happens, we'll have more information and we can address it again and maybe take care of some things that um, weren't, that we didn't cover in the first session. But it has now been, what do you think, 3 weeks?
Yeah. Yeah. It's
It's
been 3 weeks because we saw her on Tuesday and it had been 2 weeks. And she was like, look, my hand's great. Everything's still fine. And that marble, that knot had not returned. And she had
yeah,
full motion. Yeah.
yeah, just totally normalized in her hands. So, oh, you know what? I might have hit my keyboard is what the problem is.
That might be it. But yeah,
Yeah,
while you're figuring that out, yeah, I feel like she was ready. And it's amazing when we get to see those things happen in real time, especially when you're teaching a class and using that as a demonstration. It's so nice to have that healing happen and be able to see the follow up of it in class. That was really unique as well, because often we share stories or you do a session, but then you get to demonstrate the fact that that continued to work for her. And like I said, sometimes we need to reinforce because sometimes there's some things that, there's different angles. There may be different things that are happening in the subconscious that are reinforcing that particular behavior in our minds or our bodies. But in this instance, yeah, she was ready to let that go. And it was really amazing to see. I always share that even the CDC, right, Centers for Disease Control, will say that 85% of physiological conditions have a psychological component. So it's always so important to have the whole care team. It's important, yes, of course, to get things addressed physically, medically, but also to look at the underlying root causes of what's going on or what's continuing that to happen. Because I know I've experienced before that, sometimes in our recovery, we might hit a plateau or you might backslide or only be able to get so far. And then there's generally something going on below the surface. There's something in our nervous systems or subconscious that's stuck there. Like you said, that shock, that trauma that just needs to be addressed and processed and released in order for our bodies to be able to heal the way that we have the ability to when we are working on all cylinders at our best. But if you're subconscious, if there's something that's holding back, there's something that's resisting or sabotaging that from happening, you're never going to be able to get to that full healing potential. So it was very, fascinating and beautiful to get to see that in action and to have your class be able to see that as well. I'm sure that was very gratifying as an instructor to be able to be like, okay, this is how it works and this is what's possible.
Yeah, and it's fun when, if I'm doing a demo, that there's always somebody in the group that has an issue that matches what I need to demonstrate. And, if she hadn't had that, we would have, I don't know, we would have just looked at somebody's old surgery somewhere, I guess. But it was just a perfect demonstration. And I even had students email me afterwards going, that was a miracle healing. It
Because that's how
really
it
was
feels, right?
dramatic.
It feels
It
like
was dramatic.
miraculous because we can get results more deeply and much quicker
Yes.
by bypassing that conscious critical mind and going right to the source,
Yeah.
figuring out what's going on under the surface. How was her subconscious trying to protect her and guard against this trauma and was holding on to that, like you said, that shock. And, so much of that trauma is not being prepared. So processing through all of that over again, it was like going back and being able to mentally prepare her of like, what can you do to protect yourself and how can you do these things versus that shock of being out of control or being
Right.
startled or the surgery is traumatic on our bodies too, and cut open all of these things. So yeah, it was really a great demonstration for those techniques that you were teaching.
Right. Well, one of the early sessions I had early in my career,
Mhm.
a woman had come to me, and we had been working for several sessions. And then one day she said, um, I'm going in, I've scheduled surgery to recover from double mastectomy. And what they had to do is they had to go back in and they would cut open the groin and take muscle material and crisscross it across her body and attach it to the shoulders. And she said, this is going to be extremely invasive. Can you help me? And that was the first time, at least that I recall, that I really had, well, I had had another client before that regarding a medical issue, but this was really dramatic and really invasive, because they would have to be going all the way through her torso. And so there was so much of her going to be violated, you might say. And so um, what we did was we went in and talked to each part of her body and prepared the body and told it that she loved the body and it wasn't to be a punishment. It was to really help her to be more healthy. And even if the body is tense and kind of tremorous about going forward, we do what we can to relax it and to get it on board, to know that this is something that's going to be life affirming, not a punishment or torture or something like that. And so then the body relaxed. We got permission from every part of the body that was going to be involved. And then we did some work around training the subconscious mind that the healing could be very rapid, that the body would not have to um, abide by the customary healing timeline, that it could happen very rapidly, if not instantaneously, and very smoothly, so that all the cells are knitting back together just beautifully and naturally again with minimal scar tissue. Well, she went through this surgery and I saw her afterwards, and she said the surgery went so smooth. The doctors were just shocked at how easy it was to get this done. The recovery was so fast. And again, the doctors are shocked at how quickly she recovered and how well she recovered, how, seamlessly. So doing this work pre and post surgery is vital. It's so important and so helpful for anybody if they're facing a surgery to do this work.
Yeah, absolutely. And, I do a lot of this when I'm working with people who are going through birth, right? So whether that's natural physiological birth and helping them and their babies prepare for that, or whether it's surgical C-section and helping them and their child to prepare for that. So it is a more positive experience. They can feel more informed and empowered and, like I said, get the permission from all the parts of their body. And have all of them working together versus at those cross purposes. And so it's not a traumatic experience. And also any kind of chronic pain and health conditions, helping people go through different procedures if they have biopsies or MRIs or anything that people are going through. It's such amazing work to help someone to feel better about the situation and to really help them either to resolve those past traumas from those past surgeries or experiences. There's a lot of medical trauma out there, or to prevent that. I mean, how beautiful is that to prevent? My mom actually had a very similar surgery to what you're describing, where they had to take muscles from other part of her body and rebuild. And it's very invasive, like you said. And so, being more mentally prepared for that and being more relaxed and being able to not have all that fear and tension in your body is going to help you recover so much better.
Yes.
So yeah, just such powerful work. So Mary Lee, I would love for you to share a little bit more about your course, your integrative hypnotherapy course. I know you have another round coming up in the new year. And so tell everybody who might be interested in this, because I'm sure there are coaches and healers and self-healers and people who will be interested in learning more about how to learn these techniques to help themselves and their clients.
Yeah. Well, the course is perfect for anybody who is a holistic healer, even an allopathic healer, people who do energy work, or people who want to start a business, helping others and healing others, even for spiritual exploration. So the course teaches you multitudes of techniques, dozens of techniques, both for putting people into trance, getting them prepared for the healing journey, and then multiple neuro-linguistic programming techniques, NLP, psychology techniques, and then of course past life regression, between life regression. And these techniques can allow us to help people with relationships, dysfunctional families, opening up to abundance, having better, money flow, stress management, habits, alcohol, smoking, eating, whatever those habits are, fears and phobias of any sort, looking for purpose in your life, which is really at the base of a lot of problems, is that people are directionless. They don't know where they're going or what to do. How do you know what to do if you don't know where you're going, right? What step or what direction to move in? So these techniques can help identify purpose and direction, can support people on those journeys as they navigate trauma or change. All sorts of change happens in life, whether you're moving, changing jobs, starting a family. Change is just a part of life. And to be able to navigate that gracefully. So you learn how to handle or how to work with people in, I would say, nearly every situation, including pain and trauma, those things. Every situation, the only line that's drawn really is if they're clinically schizophrenic or, clinically beyond our help. Then everybody else, for our normal citizens, our normal people who have normal issues, we can help support them through all of that. Maybe even sports performance or speaking in public, test taking. I can't even think of a topic that we would not be able to help support or heal or change and elevate them. So I guess, so talking more about the class, so the entire class is online, so you can take it online, and then there are support calls, there's 20 hours. So it's 10 weeks of 2 hours each. And that's what we've been talking about, where I present the techniques. We cover a lot of what's in the online class. I do demonstrations. I answer everybody's questions. And then people are allowed, so you can start the course anytime at all and start studying. And then about 3 times a year, I offer the 20 hours of calls. And so for 10 weeks in usually January, February, again around April, May, and again around September, October, we start those 10 weeks of calls. Once you're in the system, once you've started taking this class, you have lifetime access to the written material. Well, they're written, there's videos, there's audios, there's charts, everything is in the online course. You can access that and go through it anytime. And then the calls, usually you're registered for the calls that come up after you. When you register for the course, I assume that you're going to come into the next calls, but you can delay that if you don't think you're ready. You can say, well, I don't want to take these calls. I'll take the ones in spring or fall. But you can come back and take those calls every single time I offer them at no additional cost. So we have a lot of students that are coming back. They come back to the calls. They share that they learn something new every single time. There's new people, new questions, new demonstrations. They, once they're out in the field, they're working, maybe they have a whole new level of questions that are coming up that now they come back to class and they can ask those questions and get support as they're working with their people, with their clients. And also included, we have what I call the Soulful Hypnotherapy Community. It's a private Facebook group. And so if you are a student or graduate of any of my programs, or most of my programs, you have you get a link to apply to come in, and then I accept you, and then you're in our group. There you can post your successes, you can ask questions about your challenges, you get ongoing support, you can list your events coming up, you can share, you can find practice partners. So then that is another ongoing support system that you'll have moving forward. So, a lot of courses, the course I had even years ago, you graduate and you're off. You never see these people again. You don't, that's it. You don't have any ongoing support or ability to take more, to go back and review things. So this is really a unique opportunity. And the truly unique part about it is the techniques that I teach, the non-scripted, client-centered approach. The full past life and between life material is included in the class. They used to be separate. At Bastyr University, those were separate courses. But I realized that anybody who's going to be a really powerful and effective hypnotherapist is going to need to have the past life education and techniques in their toolbox. And anybody who's doing past lives is going to benefit tremendously from having a well-rounded education in hypnotherapy, because we do apply the healing in the past lives. So again, that's another unique application that I've created. So I don't know, did I miss anything, Jodie?
You covered it. Absolutely. I took the class in fall of 2019.
That was my last live class.
That was your last live class. And what was really amazing, like you said, was that I didn't feel like class was over and then you just disappeared. That I have been able to be connected and do that continuing education, to be able to access the material and to be able to access you and come back to the classes. And you're right, I do learn every single time I am able to sit in on your classes, because things evolve. People
Yeah.
ask different kinds of questions. There are different kinds of demos. People will bring up their cases that they have questions about, and there might be a new technique in there, or you might have written a new book. You've written new books since I took that class as well, like your Mastering Hypnotherapy book. So it's a really amazing support system, like you said, between all of us who are alumni and have taken the classes, and your current students, and you being able to stay connected. We get together, those of us who are more local, we get together on a regular basis, as well as that Soulful Hypnotherapy community. These are where we can reach out and do practice if we have something we want to work on, or we want to practice a technique. So it has been a great decision. I've been very, very happy that I did that, because when I was trained, it was in a very clinical setting. And like I said, I mean, this was a really long time ago, just a couple of years after you went through your training. And it was always really scripted. And if they have this, you do that. And that is not how things actually present in real life. So being able to be flexible, resilient, to have lots of tools in the toolbox. I am also very much of the mind to be very client-centered. And so I see people come into your classes who even have had training before, but it was more rigid, or it was very limited. There will be a lot of limitations to where, well, I know how to do this, but they're uncomfortable in other scenarios. If someone comes up with something else, I've noticed that they're not as confident. As you've been a past board member of National Guild Hypnotists here in Washington, and I'm the current president. And, when you are in those types of settings, you meet a lot of different people who are in our profession, and you see all the different kinds of training that people go through, and you understand who feels really comfortable, competent, and confident in their work. And the people who come through your training, to me, are the people that I see as the most competent. I know that I can trust them to refer, and they know that they can trust me, because we know the kind of training that we've gotten. And so I've been definitely talking about your programs and referring people. I know you're going to be speaking, so you're one of our distinguished speakers at our World Hypnosis Day in January. You'll have a table there. So if anybody is local, if you're in Washington or in the Pacific Northwest, come and spend time with us. I'll make sure you have that link as well. But what I love about your class is that it is virtual, so people can join from anywhere.
Yes.
So you have people internationally, all over the place, from Australia and
South Africa, Mexico, Puerto Rico, Bahamas, Belgium, England, Germany, Canada, of course. We get quite a few from Canada, all over the United States. Can't think of where else. Australia, yeah. Students everywhere. And it's wonderful. It's just wonderful. And we get to know them too, so they get to learn our techniques, which just are not presented anywhere else in the world. And so they get to spread this good work further afield.
Yeah, that's amazing. Well, I made sure that this link that's up on the screen right now, it's a little bit longer. So I made sure that this link is under all the videos. So whether you're watching this on YouTube or Facebook or LinkedIn, we'll make sure that you have the link to check out Mary Lee's programs, to learn more, and to get started. Because like you said, Mary Lee, they can start anytime and then roll into whatever the next round of live calls is. And you do have one coming up in about a month. So it'd be great for people to get started. And then in the new year, they can be adding to their skills, their tools and techniques, or starting something brand new. If they're interested in, learning a new modality and wanting to add to what they're already doing, or start a new business, this is such a great opportunity because you really do cover all their bases. They get, what is it now, 200 hours of
Mhm.
training.
So,
So it's comprehensive. It's going to, you know, get you access to all the professional organizations. If you're here in Washington, you'll be very competent. You can be a registered hypnotherapist. But anywhere in the world, that's what I love about what we do. You can reach everyone because you can work virtually. And I used to have people ask me, does that work virtually? But you really don't get that anymore after the pandemic as much. But yes, it does. Absolutely. It's highly effective. And so definitely recommend checking it out if you are wanting to help yourself or others.
yeah, ever since the pandemic, I have my entire business is virtual. I don't see any clients in person, and it works beautifully. And people are in the comfort of their own homes, and they don't have to do the drive, through traffic. Because living here in the Northwest, we've got such terrible traffic, and they can just relax afterwards and chill and journal or drink a cup of tea. So it works very, very well.
Absolutely. That's actually what drew me originally to your program because, like I said, I knew people who trained with you and I trusted them and knew how good they were. But I was wanting to make the shift to working more virtually. And I knew that you already were. And that was amazing because pre pandemic, having myself all set up already meant that I didn't have to relearn anything. I didn't have to try to figure it out. I already had people trained to know that they could absolutely work with me
Mhm.
virtually. And so, yeah, it was actually perfect timing to be able to do that. And I find, for the exact reasons that you just mentioned, that you find it to be effective as well. Sometimes
Mhm.
for it to be even more effective because they're in their own comfortable space where they're already living out all of their habits,
Mhm.
able to not have that stress and anxiety of sitting through traffic, taking as much time off, and then going back into the gauntlet again. Because, like you said, in Western Washington, especially, it's a little rough out there.
Yeah.
And yeah, and they're able to just process and integrate. So I love working with people virtually. I feel like they are not just, in an office setting and then going home, they're already where they're operating in those ways. And so that change can take effect right away. And yeah, I found it to be such an incredible tool and an opportunity for us to take care of ourselves too. And at the same time, be able to reach more people all over the world than we could just working in person.
And we don't have the overhead. I mean, we're not paying for office space and a whole setup of furniture and equipment in an office, plus the commute to an office and all of that. So it saves, for me, it saves a lot of time, a lot of expense. I have all my records on the computer now, so it saves room in my office, as far as documentation. And I just am amazed always that I get paid so well to have the most beautiful job on the planet. It's relaxing. It's, once you learn the techniques, in the beginning, yeah, it's a little nerve wracking. Am I doing it right? But once you learn it, um, you're going to relax. You're kind of in meditative trance with your clients.
Mhm.
And so your adrenals are going down, you're relaxing with them. You're learning so much about the human psyche. Every client brings this amazingly complex universe into your awareness, how they've set up their psychology and their emotions, and what triggers them, or what inspires them. And so you're learning so much about humanity, and then feeling good every single day that you are making a difference, a significant difference in people's lives. When people come to me and they're distraught and they're stressed, right now I have a few clients that are just like up here all the time with adrenaline and reactivity, and everything is just this big problem, right? And as we are, getting them to come down here and living at this calm space, it allows them to become more responsive to stress and more, their blood isn't always out at their extremities waiting for the fight or flight. They're here where they can have rational, reasonable, calmer decisions and responses, and it's so good for your brain, improved sleep, all of this. But anyway, but to see people come in with these issues, or they just can't get over a trauma or a childhood event or something that has happened, and then whether it's one session or a few sessions, everything is smoothed out, and the rest of their life has the potential to be so beautiful and free, just free of what has held them back before. So it's it's just a wonderful feeling when you know you've impacted people so positively.
Absolutely. So rewarding and such a beautiful place to operate from.
Yes.
Absolutely. That we can help them do that is a gift every day. So thank you so much for being here with me. Thank you for sharing all about your course and about that case, because that was just such a beautiful transformation. We knew we needed to share it with everyone.
Yeah.
And we're so grateful to be able to have done that. And again, all the information about Mary Lee's courses are in the description below this video. You can take a look there. And if you have any questions, feel free to post a comment, send us a message, and let us know that you saw the video. And Mary Lee, I just want to say thank you and let you know how grateful I am to have learned from you and to continue to learn from you all the time.
Oh, thank you. And it's such a delight to have you in the classes all the time. We get to see each other a lot, and it's wonderful. And you always contribute so much to the class as well. So thank you for today, and thank you for being in the classes and in my circle.
You're welcome. Thank you. And thanks everyone so much for watching. We will talk to you soon. Have a wonderful holiday season.
Thank you.
Bye for now.